I had type 2 diabetes, I had high cholesterol, I had high blood pressure, my knees would hurt, my ankles would hurt. That's all gone.
I hear a lot of, I should have done this sooner. I should have done this 10 years ago. I hear that all the time because of how good they're feeling. You know, early on after the surgery, I hear of like, wow, that wasn't as nearly as painful or as bad as I thought it would be. You're back to your normal exercise routine within 2 weeks, if not sooner, which is also very important for, you know, establishing healthy exercise habits and lifestyle. What we've learned about weight management is you get to the point where your body doesn't want you to go below a certain number. It's not you, it's not a matter of what people are doing or not doing, that's how our bodies are made, to not allow us to go below a certain weight. Right now, this surgery is the only reliable option out there for allowing you to lose more than whatever that number is, and everybody's got their number. The first thing I would say is get more information. You know, come to one of my seminars. Learn about the risks. I'm very open about the risks and straightforward about the risks. And then more importantly, after the forum, there's our support group. So stick around and talk to people who've actually had the surgery done and meet them in real life, talk to them about why they had it done, what their experience was like. And nothing is more accurate than that person-to-person contact, getting the information firsthand from somebody who's already had it done.
We went to one of the forums here at Lodi Memorial and we fell in love with the doctor. She was wonderful, and every time I went to the doctor's office, I felt like she was going to take care of me and that I was important. I wasn't just another patient. And you know, it saved my life.
We have those connections for you here at Adventist Health Lodi Memorial. We have a staff that sincerely do care about your success. We want to see you morph into that beautiful person without comorbidities anymore, without those heart issues, without diabetic medication, and one that has energy to play with your kids, and one that has energy and doesn't have aching joints or hurting feet. That's all possible. And the team here at Adventist Health Lodi Memorial, that's what we want for you. I'm really proud that in 2016, we received our Center of Excellence in Bariatric Surgery.
In order to be a Center of Excellence, there is a set of very strict criteria that we need to meet, and they look at everything from how our hospital is constructed, what kind of equipment we have, making sure that that's suitable for bariatric patients, what kind of education our nursing staff gets and our doctors get, what kind of staffing we have available. Patients can be confident that they are getting the best bariatric care when they come to Lodi Memorial. The two most common surgeries that I do are the Roux-en-Y gastric bypass and the sleeve gastrectomy. And both of these surgeries I do laparoscopically, which means instead of making a long incision, I make 5 small cuts that are about ½ inch in length. The Roux-en-Y gastric bypass has been around for 30 to 40 years, and I'm not removing anything. Everything stays in place. The sleeve gastrectomy was first described about 10 years ago and has very good results also. It's a very personal process. There are advantages and disadvantages for people with both surgeries, and not one surgery is the best option for everybody. So that's why when people come into my office, I'm spending a ½ hour to 45 minutes reviewing your medical history, reviewing your surgical history, and together we collaborate on deciding what the best surgical option is for you.
I had type 2 diabetes, and the research I did, the gastric bypass, was going to help that quicker than the gastric sleeve. I was off all my medication the day after surgery, and my blood sugars are normal now.
We have a support group here that is so essential, and actually, besides having the actual surgery itself, is the key to your success afterwards, because it's the connections that you make post-operatively with, you know, other people that are on your same journey that helps to encourage you and answer questions.
I love the one-on-one. It's a small group. hearing other people's stories, and I'm hoping that, my story will, help somebody else, because it really did save my life.
Those connections are just as important as the surgery itself. The most common thing that I hear is, I wish I would have done it sooner, it's changed my life, and that they're thankful.
It's given me a whole new lease on life, the things I can do now that I couldn't do before. I love clothes shopping, I ride a bike, going to a restaurant, all those things that most people don't think about. I embrace those small victories.